It's the week of December 13th, and this is COVID Conversations, where we discuss the latest COVID-19 news with the experts. Essential workers at hospitals across the United States are being vaccinated to protect against COVID-19, and many await to see what the side effects might be. I'm here with Jessica Ansel. She's a nurse practitioner and clinical research coordinator at the Center for Virology and Vaccine Research at Beth Deaconess Medical Center. Jess, welcome. Today's question is, what are some side effects people should anticipate when getting the vaccine?
That's a great question, Nicole. I think the main thing to think about here is that most current licensed vaccines have very similar side effect profiles. So think about the flu shot. When you go to see your physician to get that, the doctor or the nurse is always telling you, hey, you might have some achiness, you might have a fever, you might get some chills tonight. The COVID-19 vaccines are very similar and have a very similar side effect profile. The important thing to note is that these are short term. So most people after 1 to 2 days feel much better. And the history of vaccine development in general has shown us that most side effects experienced with a vaccine are either immediate or they're short term. So for the COVID-19 clinical trials currently going on, we actually monitor participants in the clinic after they get the vaccine. So they usually stay for about 30 minutes to 1 hour, which is when we would expect any acute reaction to occur. And so nurses and doctors are watching them. And then we ask these participants to also monitor their symptoms in a diary at home for the next week and to let us know if they're experiencing anything. It's actually quite rare to have long-term side effects from a vaccine. And I was actually on a talk last week with Dr. Fauci, and he said something to me that really stuck out that I wanted to share. He said, it would be unprecedented to have a long-term side effect from a vaccine. That's how rare it is to see something long-term down the road from a vaccine. So of course, there's always unknowns in clinical trials, but the history of vaccine development tells us that it's pretty safe and well tolerated down the road. And, one thing that we tell our study participants is, if you start feeling some discomfort after you get the vaccine, take some Tylenol. And most of our participants who took Tylenol when they started to feel a little achy or they felt like they were getting a fever felt much better within 30 minutes. And they said it made it a better event for them.
Mm-hmm. And how are you responding to folks who might be coming to you with misinformation about thousands of side effects or the allergic reactions? How do you help them if they come to you with those concerns?
Yeah, so I think we get a lot of that from not only people who are in our COVID vaccine trials, but we're running lots of other trials here. And I have people in other trials asking me, hey, what do you know about these vaccines and the side effects? I have friends and family who are emailing me and texting me and asking me the same questions. I think the biggest thing, especially from a nursing perspective, right? So nurses are bred to educate. So I think it's super important for healthcare providers everywhere just to educate the general public in language that they understand, right? So not using this science mumbo jumbo, but really just in language that people understand and say, hey, this is what the data has shown us so far. These are the real side effects. Oh, you heard about this, from Karen on Facebook. That's probably not right. That doesn't seem like it's coming from a reputable source. So I've done a lot of that with family and friends, and I would really encourage everybody else in the healthcare field to do so.
Super important that people are getting their information from reputable sources, trusting the science, and listening to our nurses and our doctors. They're working really hard.
Agree.
Excellent. Awesome. Jess, as always, really appreciate you taking the time with me. This is COVID Conversations, where we sit down and we talk about COVID-19 news with the experts. Thanks, Jess.
Thank you.